a direct supervisor who, in effect was giving me really good feedback and praising how much my work, was contributing to the financial growth of the organization. But then in parallel, they were also imposing kind of their own career trajectory, kind of views and preferences on kind of the expectation that they had for me. So said differently, we were talking about my advancement to a different role, where in effect, the manager had acknowledged that I was already functioning to that role, but basically said, well, you're a PhD, so first you can't be an executive. And then second, that's not how I got to that role. And, I had to do A, B, and C. And so therefore, for you to do that, you'd have to do A, B, and C too. And so, we're kind of trained to, right, follow our superiors and, when you're early in your career, especially. And it was a turning point to say, well, I actually disagree. And I'm not going to let one, even though they're your boss, I'm not going to let one boss's feedback actually dictate, what I think I'm capable of doing and kind of limit my potential. And ended up actually kind of using that moment to resign and realize that maybe it's time to move on. And turned out that I was able to basically fulfill that role in other organizations pretty shortly after. So that one manager really, didn't stop me from pursuing what I actually really wanted to do. I would say the first book that everybody should read is called The New Health Economy, Ground Rules for Leaders, which is actually a book that I recently co-authored with a couple of colleagues. And the premise of the book really is a firsthand account of executive interviews. And it really applies Winston Churchill's quote, where the further back you look, the further ahead you can get. So it's a really nice primer of all the different things that have happened in healthcare and why the system is the way it is from multiple perspectives. So not just a policy perspective, not just a technology perspective. And I think it gives a good grounding for all professionals in a more contemporary way. But, if I take my bias aside out, I think I would highly recommend, it's actually a 1966 article written by Avitas Donabedian. And it's more of a conceptual framework that was started off for evaluating medical quality. But if you really learn the framework, you'll realize that it's a good construct for applying and to your thinking in whatever healthcare situation you are in. And it really helps you apply more rigor to your thinking. And I found that to be very helpful. Well, so I guess the irony is, right, I'm a researcher and, I love data and numbers. And so, things typically have to be very, evidence-based for me. And, and so it's always kind of fun for me sometimes to go down these rabbit holes where I'm like, reading horoscopes and like looking up, like the different personality descriptions of different zodiac signs and, which is always kind of just a fun thing to get sucked into sometimes.